Hello, and welcome to the Regional Municipality of Wood Buffalo Virtual Community Town Hall. Thank you for taking the time to learn more about our region's response to COVID-19. My name is Jillian McDonald, and I will be your moderator for today. We have a panel of people who will be joining us to take questions today. In the room, we have Mayor Don Scott, Scott Davis, the RMWB's Director of Emergency Management, Jamie Doyle, the municipality's Chief Administrative Officer, and Kevin Weidlich, the President and CEO of Wood Buffalo Economic Development Corporation. As well, we also have joining us on the phone from Alberta Health Services, we have North Zone Medical Officer of Health, Dr. Kristen Klein, as well as Murray Crawford, Senior Operating Officer at our Northern Lights Regional Health Center, RJ Steenstra, President and CEO with the Fort McMurray Airport Authority, Kareem Zarifa, the Executive Director of the Oil Sands Community Alliance. From Indigenous Services Canada, we also have Michael Oostendorp, Director of Community Infrastructure and First Nation Relations, Treaty 7, as well as Cindy Roach, Director of Health Promotion and Protection for First Nations and Inuit Health Branch. Today we will be talking about our organization's ongoing response to COVID-19 and taking questions from residents. Mayor Don Scott is going to give some opening remarks, followed by our Director of Emergency Management, and then Murray Crawford from the Northern Lights Regional Health Center. But first, I want to let you know if you would like to ask a question, please hit *3 on your phone and we will get you into the question queue. Now I would like to turn the floor over to Mayor Don Scott. Mayor Scott?
Thanks very much for that, and I just want to thank everyone who's calling in this evening or listening and make a few quick points. We always acknowledge at the beginning of our council meetings that this call and our meetings take place on Treaty 8 and Métis territory, and that's something I'm always proud to talk about. I want to begin by thanking all the doctors and nurses and our first responders who are on the front lines of responding to this pandemic. We need to make sure that if you know a doctor or a nurse who's going to be on the front lines of this as we go forward, make sure that you extend your thanks to them. I know that the entire community is behind them and we offer them our full support. I also want to thank all the municipal staff who are making sure that the services that people require are maintained. We have a very dedicated municipal staff and I couldn't be prouder of the efforts that they're putting forward to make sure that people are being looked after. Another message I'd like to make sure that people consider is please take care of each other. If you know somebody who might be alone or in distress, please reach out and make sure that person is getting the help they need. You don't have to be on their doorstep to do that. You can do it virtually. If there's any concerns, if you're not sure someone is okay, please reach out to them. This is a very challenging time. People are really struggling with mental health issues and, anxiety. And I've heard about it almost continually since this all came about. So please do reach out to those that you know and make sure they're getting the help they need. We really need to take care of each other. We can get through this, but we need to look after each other as we do.
Thank you for that, Mayor Scott. Up next, we have Scott, our Director of Emergency Management.
Thank you, Mayor Scott. Good evening, everyone. As you all know, this is a dynamic situation that continues to evolve. Earlier this afternoon, Alberta's Chief Medical Officer announced there are now 968 confirmed COVID-19 cases in Alberta, including 55 in the North Zone. The province's geospatial online map is reporting 3 confirmed cases in Fort McMurray. I know watching the number of cases increase can be stressful for many, but the nature of this virus, this is expected and was planned for. I am encouraged, however, that 174 have recovered in Alberta. It's also a reminder that this is a marathon, not a sprint, and we must continue to follow public health orders and work together to protect our community. Everyone has a role to play, and I'd like to thank all the community members who continue to follow public health orders and recommendations, respect the closures in the region, and adjust their everyday lives to protect themselves, their neighbors, their family, and our community. I'd like to remind everyone that public health orders are now enforceable by law. For those wishing to file a complaint, there's an online submission form available on the province's website. We are continually monitoring our response needs at the Regional Emergency Coordination Center and adapting accordingly. There's a dedicated team that is committed to sharing information and updates with our Indigenous partners, Métis groups, industry stakeholders, and other important community groups. This is very important dialogue, and we continue to check in with these groups regularly. As this situation continues to evolve, please know that the municipality is here for you and will continue sharing information about the regional response as it becomes available. Updates, service changes, and community support resources continue to be available on the municipal website, rmwb.ca/COVID-19. Alberta Health Services remains the leading authority on our municipal response and the trusted source of information on public health recommendations for our region. Factual, up-to-date information will continue to be available on the AHS website. As I've mentioned many times throughout this evolving situation, we must remain calm, follow all public health recommendations, and stay the steady course. We are a resilient community that's been faced with challenges before. Let's look out for each other and continue to work together. Please have patience. Patience for yourself, patience for others. We will get through this. I'd now like to turn it back to our moderator to facilitating some of the questions you may have at this time.
Thank you for that, Scott. Now we will ask Murray Crawford to give an update from AHS. Go ahead, Murray.
Yeah, good evening, everyone. Thank you for including Alberta Health Services in the meeting tonight and continuing to put your trust in us as we continue to keep Albertans safe. My name is Murray Crawford. I'm the Senior Operating Officer for Alberta Health Services Area 10, including Northern Lights Regional Health Centre in Fort McMurray. I'm very pleased tonight to be joined again by Dr. Kristen Klein, our Medical Officer of Health. Before we start, I'd like to express AHS's sincere thanks to the amazing healthcare workers and physicians who are stepping up every day in response to this epidemic. We are very grateful for their work. Thank you for having us here tonight, and we're happy to answer your questions.
Thank you so much, Murray. Now we're going to turn to our question queue. Again, if you would like to ask a question, please press *3 on your phone to be connected to an operator. Let's begin. Our first question comes from Agnes. Agnes asks, why are airports still open and operating? RJ from the airport, could you take this one, please?
Yeah, thanks very much. This is a great question, Agnes, and I expect that there are many residents. Let me just start by providing a little bit of background.
RJ, sorry to interrupt, but your line seems to be breaking up on us. Maybe try speaking really directly into your phone, please.
Yeah, I can. Can we hear me now, or?
We can hear you.
Okay, terrific. Let me just start by providing a little bit of background because I think it will start and help answer the question that you asked. As you know, the entire aviation industry, including Fort McMurray Airport, has been closely monitoring COVID-19 developments since late December.
RJ, I'm so sorry, but your line keeps cutting out on us. Could you perhaps call back from another line? And we can come back to that question.
Does it work if I just pick up the receiver?
Yes. Give that a try.
Okay. So let me just start again with the question provided. YMM is.
Sorry, RJ. It's still not working. It's a bad connection.
Okay.
So,
I will call back.
We'll reserve your question.
Thank you.
Thank you. Okay, again, if you wish to ask a question of our panelists, please hit *3 on your phone. Our next question comes from Dennis. Dennis asks, are there any coronavirus patients in the hospital, and if so, how many? While we're waiting to get Murray back on the line, Dr. Klein, would you be able to answer that at all? Sorry, Murray or RJ could take this one, or Murray or Dr. Klein, my apologies.
Maybe Murray. I can take that, Kristen. Yeah. Right now, we have no confirmed cases of COVID-19 in our hospital in Fort McMurray.
Perfect. Thank you for that. Again, if you wish to ask questions of our panelists, please hit *3 on your phone. We will also be asking some polls tonight, so please stay tuned for those. Our next question comes from Melanie. Melanie asks, can you address the amount of people in stores right now? There should be only one person per household shopping. Scott, could you address this, please?
Thank you. Sorry. Thank you, Melanie, for your question, and it's a great one. We continue to work with the businesses that are open in the community. I'm encouraged by the steps they're taking to have social distancing, and I do know that I've spoken to a number of different managers. They continue trying to keep their patrons as well as their staff safe. They are monitoring the number of patrons that are coming into their businesses and encouraging social distancing.
Thank you for that, Scott. Again, if you wish to have your questions addressed, please hit *3 on your phone. Our next question comes from Greg. Greg asks, why can't council mandate a mandatory 14 and 14 shift for all sites to have less traffic into the RMWB? Mayor Scott, perhaps you could address this, please?
Yeah, council can't mandate the work schedules for businesses. I mean, we can give direction on what we think is appropriate, and we have been in close contact with the leadership of the various organizations, including OSC, and I believe Kareem's on the line. He may want to weigh in at the end of this, but they are giving us updates on all the steps that they're taking and trying to reassure us that they are trying to protect their employees. Kareem, can you add to that?
Yeah, thanks, Mayor Scott. What I can say is that in many cases, sites have reduced their workforce by more than 50%, and that's for critical and essential workers. So I think that addresses the question.
Thank you for that, Kareem. Again, if you wish to ask questions of our panelists, please hit *3 on your phone. I believe we have RJ back on the line. So RJ, if you could answer, why are airports still open and operating, please?
Yeah, thanks very much for the question. Can you hear me clearly now?
Very clear. Thank you so much.
Terrific. Okay, so just a little bit of background. Obviously, we've been following this COVID-19 development since late December. Airports across the country are classified as critical infrastructure, and with that comes a federal mandate and a responsibility to our communities to adequately prepare and respond to emergencies such as natural disasters, the wildfire in 2016, and pandemics like we're facing here in around the world. So to answer the question, the airport is an essential service, and we have to remain open for important medical and domestic air travel and to facilitate the movement of important supplies in and out of the community. When I say important domestic travel, I'm referring to YMM's role in bringing Canadians and residents home. We are part of Canada's critical infrastructure network, and we need to continue to work with other airports to do this safely. And at the end of the day, there's nothing more important to us as the airport than the health, safety, and well-being of our customers, terminal personnel, and of course, all of our employees here at YMM.
Thank you for that, RJ. We could hear you loud and clear.
Right.
Tonight we will be asking callers to participate in a few polls throughout the town hall. Our first poll this evening is about getting information to our residents. So due to the COVID-19, we have had to close municipal offices and change services like waste collection or transit. All of this is a part of our municipal response to COVID-19. We would like to know your preferred way to get your information on municipal response. Press 1 or on the website, rmwb.ca/COVID-19. Press 2 for municipal social media channels like Facebook or Twitter. Press 3 for during a virtual event like this town hall. Press 4 if you receive your information through radio ads or radio announcers talking about it. Press 5 if you get your municipal information from other places like the news articles or from friends. Since you can only answer one, please select the place you most frequently obtain your information. Again, press 1 for the website, press 2 for social media, press 3 for a virtual event like this town hall, press 4 through radio ads or radio announcers, press 5 if you get it from other places like news articles or from friends. Our next question comes live on the line from Amika. Amika, your line is open. Please go ahead.
Good evening, everyone. Thank you so much for the efforts in keeping us safe so far. My question goes directly to the Indigenous directors on the line today, and it's concerning mental health and addiction. And I want to ask what is in place for those with addictions and mental health problems right now, as most of the treatment centers are closed off and even the detox centers are very limited in their intake. Thank you.
Thank you for your question. We'll ask our Director of Emergency Management to try to address that, please.
Good afternoon, everyone. First of all, I'd like to thank the Mayor for acknowledging that we are on Treaty 8 territory and that we are also in a number of Métis communities up in northern Alberta. And also want to thank for Indigenous Services Canada to be involved and participating today. In regards to the mental health assistance programs, we are working closely with our First Nations partners to ensure that critical services such as mental health supports are still available to community members. So that is ongoing with our First Nations partners in the area. In addition, as part of the Government of Canada's announcement on the response to the COVID-19 pandemic, funding has been made available in the amount of $305 nationally, or $305 million nationally, my apologies. That is to be available to First Nations communities and also to be available to for proposal driven for Métis communities and friendship centers for individuals who may be living off reserve. One of the areas where those funds can be used by these groups is for mental health assistance and emergency response services.
Thank you so much for that, Michael. Appreciate it. We're going to ask another poll question. Our next question asks, how aware are you of mental health resources in the region? Press 1 if you're very aware. Press 2 if you are somewhat aware. Press 3 if you're slightly aware. Press 4 if you're not aware at all. And press 5 if it's not something that you're interested in at this time. Again, how aware are you of mental health resources in the region? Press 1 for very aware. Press 2 for somewhat aware. Press 3 for slightly aware. Press 4 if you are not aware at all. And press 5 if it's something that you're not interested in at this time. I'd also like to remind you, if you wish to get a question into the queue, please hit *3 on your phone and you'll be connected to an operator. Our next question comes from Mike. Mike asks, he says, I see a lot of people breaking the rules. It seems we don't see a lot of enforcement. What is being done for enforcement? Scott, could you address this, and perhaps Jamie? Jamie will take this. Great.
Thank you, Jill, and thank you for the question, Mike. I would encourage you, if you do see something, to call our pulse line. Secondly, we do have bylaw officers and peace officers. Always they're patrolling our entire region, which is quite large. So they're out there every day patrolling, and sometimes they do miss things, so I'll admit that, and sometimes they get a lot of things, or a lot of enforcement. So if you do see something that's happening frequently and we're missing it, please, by all means, call it into the pulse line, and we'll ensure to monitor the area a bit more than normal. Thank you.
That, Jamie. And we have our final poll question that we'd like to ask you. Our last poll question is, how aware are you of provincial and federal financial support programs that are available? Press 1 for very aware, press 2 for somewhat aware, press 3 for slightly aware, 4 if you're not aware at all, and 5 if it's not something that you're interested in at this time. Again, how aware are you of provincial and federal financial support programs that are available? Press 1 for very aware, press 2 for somewhat aware, press 3 for slightly aware, press 4 if you are not aware at all, and press 5 if it's not something that you're interested in at this time. Again, a friendly reminder, push *3 on your phone if you'd like to ask a question. Our next question comes live on the line from Janice. Janice, your line is open. Please go ahead.
Hello, everybody. Thanks for taking my question. I just want to give a scenario first, and then I'll ask the question with this. So your husband displays symptoms, and he self-isolates after calling 811 and filling out a COVID-19 questionnaire. Then several days later, the wife starts to display symptoms and self-isolate. Does the husband, this is my question, does the husband have to re-self-isolate? That would be for our Dr. Klein, please, this question. The second question I have quickly is, if you have had no testing for the COVID-19 but had the symptoms and self-isolated, can we avoid the economic downturn and return to work? Or would we have to have the confirmed testing to say that we did have that COVID-19? Thank you so much for taking my questions.
Dr. Klein, could you address that, please?
I can. Thank you for the question. So the first part, I heard if there are 2 household contacts that both develop symptoms at sort of different times, the recommendations I would give would actually depend on the results of those tests if the tests were completed. So if the first person in the house had a test and the test came back as COVID-19 positive, the second person in the house would actually be asked to self-isolate for 14 days and monitor themselves for symptoms. If they did develop symptoms, they would actually be called a probable case of COVID-19 by our communicable disease control team and would receive additional requirements for isolation. If in fact both people are not tested, then the isolation recommendations would be the same for each person, that they would be isolated for 10 days from the onset of symptoms. So it kind of depends on the scenario, but for more advice on that, there is some additional information on the AHS homepage about how to interpret results and some advice regarding self-isolation. For the second piece of the question, which I think I would probably need you to repeat, if that's okay. Is that possible?
I believe she had a question. I heard something about the economy and coming back to work and
okay. Sorry, I can remember that now. Sorry. For anybody that has symptoms, the requirement is to be off of work and self-isolating from 10 days from the onset of symptoms and until the symptoms resolve, whichever is earliest. That is the public health recommendation and is actually legally enforceable now by orders from the Chief Medical Officer of Health. So if you do have symptoms, that is the requirement for any Albertan at this time.
Thank you so much for that, Dr. Klein. Again, if you would like to get your questions into the queue, please hit *3 on your phone and you will be connected to an operator. Our next question comes live on the line from Douglas. Douglas, your line is open. Please go ahead.
Hi, thanks for taking my question. I just want to say thanks to Scott and all the leadership for you guys' hard work. And I'd like to ask a question regarding testing. So how much testing has been done in the region, and do we know? And what's the priority for the testing? And are we making sure there's not a community spread that we're not sure about?
Thank you for your question, Douglas. Dr. Klein or Murray, would you be able to take this?
I can answer that one if that's okay. So within the North Zone, which is the numbers that we have for the numbers of testing, there have been almost 4,900 tests done. And Alberta is actually doing more tests in our province and anywhere else in the country at this time. There have been changes to the testing strategy overall in the last couple of weeks, where initially it was really focused on returning travelers, and now it's more on high-risk populations and including healthcare workers. So what we are going to see is a change in how we're detecting cases, and that is with the assumption that there are cases within the community and that there will be people that have symptoms that are not tested. So I think that just reinforces the need for everybody that has symptoms that could be COVID-19 related. So that would be fever, cough, shortness of breath, difficulty breathing, sore throat, or runny nose. It's imperative to stay home for 10 days and self-isolate because it could very well be COVID-19 with the amount of disease now that is circulating within Alberta as a whole.
Thank you for that response, Dr. Klein. Our next question comes from Keith. Keith asks, will the municipality be following suit with Edmonton and Calgary with layoffs of staff in the facilities that have been shut down? Jamie, could you address this, please?
Thank you, Jill, and thank you, Keith. I understand the challenges that other communities are experiencing, as well as the challenges organizations and businesses face within our own region. We've established several measures regarding municipal employees during this unprecedented time. We've identified essential service areas at the municipality, and we'll look to redeploy our employees into different roles to assist areas that are experiencing workforce issues as focus on our region's response to COVID-19 and this impact continues. We plan to continue to look for redeployment opportunities first and foremost, and understanding that our commitment to helping keep residents safe and healthy while providing important services, programs, and projects is a priority. We've also implemented a working from home or working from remotely procedure. This enables employees who can to work remotely. An example of how we're doing some of this is redeployment of employees to assist with cleaning of buses from Human Resources. Transit struggling, as an example, to keep buses clean and to clear snow. So we're using employees to help do some of those activities as well. Thank you.
Thank you for that, Jamie. If you have friends who you think would like to participate in this town hall, we ask that you direct them to our website, rmwb.ca/COVID-19, and there will be a link to the call. Our next question comes from David. David asks, why are all the stores closing at 8? Oil sands workers are still working at that time and not able to get groceries. Scott, could you address this, please?
Thank you, David. Great question. We've been in conversation with a number of businesses and looking at the consideration for oil sands workers. I do know that after talking to some of them, we're trying to work on strategies as to how oil sands workers could either pick up or have it delivered their products. I haven't received confirmation on those strategies yet. It's all I have at this time.
Scott, I believe Kevin would like to weigh in.
There are a few businesses in town that have started offering some grocery delivery services. One that immediately springs to mind, a very innovative approach, is 57 North. So it's a restaurant, and they've undertaken to deliver prepackaged meals as well as to take grocery orders. So that's one example of a business that would offer services. I'd encourage people to get online, use social media, speak to neighbors and friends, and as things develop, more individuals and groups are going to step up to provide services like this. The point about accessibility to the stores is well taken, and we as Wood Buffalo Economic Development will reach out to OSCA, and perhaps we can start some conversations as to what we could do that's still compliant with the restrictions.
Kevin. Our next question comes live on the line from Bradeep. Bradeep,
yes.
Your line is open. Go ahead.
Hello, everyone on the panel. This is testing time for everybody else, everybody in this town, and we have been once again subjected to this kind of problem. I hope we can set up some voluntary services that enables seniors to take access to groceries or whatever. Is there any provision done for that kind of thing? Volunteer list?
Thank you so much for your question. Scott, could you please take this?
Thank you, Pradeep. Great question. I'm encouraged to hear of residents such as yourself that are wanting to help out. So yes, during an emergency situation, we do have emergency social services, as well as for this incident, we're currently working with our community services and department and looking at ways of using volunteers where appropriate. So what I would encourage you to do is reach out through Pulse and give them your name and a way to contact you, and I'll have someone contact you tomorrow.
Thank you so much for that, Scott. And if you need to contact Pulse, the Pulse contact number is 780-743-7000, or you can reach them via our website at rmwb.ca/pulse. Again, if you wish to get your question in the queue, please hit *3 on your phone. Our next question comes from Manuel, and it's live on the line. Manuel, your line is open. Please go ahead.
All right, thank you. And thanks to everyone who's answering questions right now. And my question is, how prepared is our hospital? I've been hearing a lot on the news that there's been shortage of protective equipment and equipment such as ventilators. So my question is, how prepared is our hospital to deal with this? Thank you.
Thank you so much for that question. Murray, could you take this, please?
Yeah, for sure. Thank you, Manuel. There is no shortage of ventilators. There is no shortage of protective equipment. We have national stockpiles of these items, and I would suggest you put the trust in Alberta Health Services. We will ensure that to the best of our ability, we'll take care of everyone that that enters our facility. And so, yeah, you don't have to worry about these things. We are prepared, and we've been planning for quite some time for many different scenarios, and we think we're ready to continue to battle this pandemic.
So much for that, Murray. Our next question comes live on the line from Diane. Diane, your line is open. Go ahead.
Good evening. I'd just like to thank you very much to the panel for all of the hard work that you're doing. My question actually is directed towards Don Scott, and it's with respect to small business. I'm just wondering what, if anything, you are prepared to do for small businesses, which I believe are the backbone of this community, should this pandemic last up until July.
Thank you for that question, Diane. The line was breaking up just a little bit, so I'll just repeat, I believe, what you said, which was, what are we doing for small businesses that are in danger of failing? I believe Mayor Scott will take that first, and then Kevin will follow up.
Yeah, and thanks very much for the question. Small business is the heart of this community in many ways, so it's something that's been very topical. We had a discussion about it, not at the last council meeting, which was an evening council meeting, but at the one before that, which was a Tuesday night. And we set up a task force to see what could be done to make sure that we're in a position to bounce back as a region. We're going to get through this, but we want to make sure businesses get through this as well so that they're in a position to bounce back once we get through this COVID challenge. And there's also been a lot of federal and provincial supports that have been announced, and I know that people are paying attention to those. I'm never fully satisfied with all the supports because I always want to see more. Another thing that happened at the last council meeting, that was the evening council meeting, is we're going to start lobbying other levels of government, because what we're hearing is that commercial renters are really struggling and they're having difficulty in these circumstances. So it's something that we'd like to see other levels of government address. Now, Kevin Weidlich with Economic Development is also with us here today, and he might want to supplement what I just described. Kevin?
Yes, thank you, Mayor Scott. So the task force, we just announced the members of the main committee, and we'll be meeting for the first time next week to develop some strategies. At a high level, really the question that we'll pose to many experts, and we're also seeking advice and expertise from many quarters, particularly around recovery for small business, which is what can we do locally within our means to support small business around specific strategies. That's both for the municipality and Wood Buffalo Economic Development. We have some ideas, but we want to seek expert advice. As the mayor mentioned, we also want to have a full understanding of what's taking place from the federal and provincial governments, so we don't repeat that, and what are the gaps, so what can we do to help. But the focus is post-emergency. In other words, after the last of the public health restrictions, what can we do? So we are taking this short time period to think and to understand the problem so that we can come out of this. But there is another side to this which needs to be said. This situation is bigger than Fort McMurray and Wood Buffalo. The situation is actually affecting the entire developed world. In Canada, the number of small businesses that are struggling is enormous. And this has not been seen in generations. And as much as we do, and we will make every reasonable effort we can to ensure that small businesses can get through this, but the headwinds in front of us are enormous. And there will be small businesses that will not be able to come out of this on the other end. The question that we're trying to answer is how many can we ensure that will get through this? That's all I can give you.
Much for that, Kevin. Again, if you wish to have your questions addressed, please hit *3 on your phone and you'll be connected to an operator. Our next question comes from Luana. Luana asks, how are you honoring your patient-first strategy of ensuring patients and their families are fully informed and involved in decisions about their care when you are moving seniors out of town with as little as 2 hours notice? Could Murray or Dr. Klein take that, please?
Well, I'd like to give it to Dr. Klein, but I'll take it. This is the movement of some of our vulnerable population out of our hospital was a very calculated risk mitigation strategy that we developed. It's a provincial program. We're moving all hospitals are moving their what are called alternate levels of care patients out of acute beds and acute wards and moving them to places where they're much safer. And that means they have to leave our hospital, because the last place we want is these alternate levels of care patients intermingled with COVID positive patients. And so the decision was made to move them temporarily to other facilities, AHS facilities, long-term care and continuing care facilities in the North Zone, as close to home as possible. But obviously Fort McMurray is quite a ways away from a lot of places. And the idea is to move them out, and that not only protects that vulnerable population, our seniors, but it also gives us capacity in our hospital for acute beds when and if we have to admit increasing numbers during the surge of COVID-19. So it's definitely it's short notice. We understand that. It's not convenient. We understand that. And we do feel sorry for that. But believe me, the decision to move our vulnerable population who are in acute beds right now, who don't need acute beds, is truly putting the patient first, in that we're providing a better, safer, more appropriate setting for them to care for them, and we're also putting patients first by ensuring that we have enough acute beds to take care of people who really need to be in the hospital during this pandemic. And so we appreciate your patience, we appreciate your understanding, but this was done with the best interest of the patient from many angles. Thank you.
So much, Murray. Again, hit *3 on your phone if you wish to ask a question. Our next question comes from Sarah. Sarah asks, do we have access to virtual doctors? If not, is this possible? Murray or Dr. Klein?
I assume you mean by virtual doctors, you mean by telehealth, and yes, of course, we have that process in place now. Christy, do you have anything you want to add to that?
I think the only thing I would add is there's a couple of different routes that this happens. So one is telehealth, which Murray alluded to, where you can have a visit or consultation with a physician. There are also opportunities to have phone visits with family practitioners, which was opened up and is being encouraged by the provincial government as well. And then there are private companies now that are offering these types of services. I'm sure people have heard of things like Babylon, which are offering clinical services as well in a phone environment. So if you do have a regular primary care provider, what I would ask people to do is to talk to that provider and see what kind of relationships they have available, and if they have phone consultations or other methods of providing that patient care, particularly for people that are being isolated at home, that are being encouraged not to seek care in other types of settings. That's a really great opportunity.
Thank you so much for that, Murray and Dr. Klein. Again, if you have friends who would like to participate in this town hall, we only have about 20 minutes left, so it's important that they get on the line so they can get their questions answered. They can visit rmwb.ca to link into the call. Our next caller is live on the line. Frank, your line is open. Please go ahead with your question.
Yes, thank you for taking my call. My question is regarding renter protection. What renter protection is involved? How can you be protected from your landlord or whatever?
Thank you so much for that. I'm not sure that we have somebody in the room who could directly address that, but Mayor Scott will take a stab at it.
And I just wanted to clarify, I don't know if he's still on the line, but did you mean commercial rents or residential rents?
I'm renting residential rent. I'm renting a condo off a guy, right? And I'm paying my rent as of now, but I'm laid off. So, what protection do you have? You can't just throw you out the street this time of the year.
Yes, the government of Alberta made several announcements related to that about when people can be evicted. There's a period now that you cannot be evicted. There is also, I believe there was a news release on it now. I don't have that news release in front of me, but I'm going to give you an email, and if you send me that email, I'll be able to get you the entire news release, which provides the details of what the government of Alberta is doing. They're the ones who have jurisdiction over rent, so I want to make sure that you do get that information. I'm not sure if you're able to stay on the line after the call. Yes, I'm being told that you can, so stay on the line after I disconnect, and then they're going to give you an email to contact.
Thank you very much.
That, Mayor. Thank you so much. Again, if you wish to have a question in the queue, we ask that you hit *3 on your phone, and you'll be connected to an operator who will put your question into the queue. Our next question comes from Mary. Mary asks, what is the airport doing to make sure people who are sick and fly into the community don't spread the virus? RJ, could you address this?
Yeah, absolutely. It's a good question, Mary. So just to start, so for a month now, we've been closely following the guidance of Public Health Agency of Canada as it relates to all of the travel restrictions, advisories, and the prevention measures that we can take. We've also really paid attention to amplifying this guidance throughout the terminal. so we can ensure that everyone working and traveling through YMM has trusted information. Airports across the country, they work as a network, so residents returning to Canada from abroad would have received a medical screening as part of their re-entry into the country. And so now with the new federal government measures in place that give airlines the ability to refuse travel, operators, we can further enforce this ability to deny boarding to travelers who are showing symptoms and or displaying symptoms. So these are just some of those measures that our airline partners and the airport have taken to reduce the transmission of the COVID virus.
Thanks so much for that, RJ. Again, *3 on your phone will get you into the queue to have your questions asked. On that note, I'd also like to just mention what physical distancing means. That means that you need to keep at least 6 feet from others when you're going out. And you want to make sure that you're washing or sanitizing your hands after touching communal surfaces. So important things to remember when you're out in the community getting your essential items. Our next question comes live on the line from Chris. Chris, your line is open. Please go ahead.
Hi, I'd like to know what Wood Buffalo is doing to get our property taxes deferred.
Thank you for that. Jamie, would you be able to address this, please?
Thank you, Jill. And Chris, thank you for the question. At the last council meeting, council actually directed administration to come forward with a recommendation specifically to deferring residential property taxes as well as medium and small businesses. So it is something that we're currently working on, and stay tuned to council for the next recommendation from administration.
Thank you so much for that, Jamie. Our next question comes from Dylan. Dylan says, I live in Fort Chipewyan. What's the plan if there is an outbreak all the way out here? Scott, could you address that, please?
Hi, Dylan. I can give you part of the answer, but I would also look to, I believe, Indigenous Services Canada and First Nations and Inuit Health Branch are also on the call. We continue to work with up in Fort Chip. As you know, there's multiple partners that are involved in that community, and we are part of a regular call with them and sharing information and listening to their concerns. If I could ask that either FNIB or a representative from ISC could take this. Thank you.
Andy or Michael, do you guys have anything you could add?
Yeah, it's Michael here, and so we've been working closely with the two First Nations in Fort Chipewyan, with Mikisew and Athabasca Chipewyan First Nation, to see what their pandemic plan response is in coordination with Nooney Health Authority. We have also worked closely Indigenous Services Canada to bring up temporary trailers for isolation in the hopefully non-event that there is an outbreak in the community. So there has been planning that's been put in place. There's been temporary structures that have been put in place, and we'll continue to work closely with Nooney and the First Nations and the Métis community in that eventuality.
Thank you so much for that. Our next question comes live on the line from Almerman. Almerman, your line is open. Please go ahead.
Hi, my name is Almer Herman. Good evening, everybody. I've got a few questions here, or concern here in Wood Buffalo region in the rural hamlet, regarding the elders and the seniors here, the vulnerable ones here, they don't have much money, and they don't have access to go to town, to go to Fort McMurray to go shopping, and then the local stores here 10 miles across, which you have to pay $20 to go get it. And first of all, this elders here that's living off reserve, treaty people that they have no one to turn to, and they just go and hardly been notified what's going on with the COVID-19 here. Like we are on a lockdown here on from 6 in the morning till 9 p.m. starting here pretty soon. So it's like lots of these elders here and seniors, they don't have enough money to even look after themselves for hygiene and stuff like that, and all these old houses that they're living in, they are almost condemned. So that would cause more virus. So I was wondering where we can get help through or have a good, clear communication between while this COVID-19 is on here.
Thank you so much. So if I understand correctly, you're asking what resources are available for seniors that live in some of our hamlets and how they would get to Fort McMurray to be able to get their necessities, correct?
That's right.
Thank you so much for that. I do know that we offer some transit services in some of the rural areas. Jamie, could you comment on that, please?
Thank you, Jill. Yes, we certainly do. They're varying times. I wonder if is it possible for me to give some information or provide an email address so the individual can get back to us, because I'd like to have a conversation. So, through Pulse maybe?
We will get his contact information and we'll get you guys in touch, okay?
Thank you.
Thanks. Again, if you wish to have a question in the queue, we ask that you hit *3 on your phone. *3 will get you to an operator who will be able to get your question in the queue. Our next question comes live on the line from Samantha. Samantha, your line is open. Please go ahead.
Hi, thank you for taking my call. I just had a quick question here. I know the provincial parks are closed, but here coming up with summer coming up and everything, what's going to happen with the privately owned campgrounds and lots that you have? What do we do there? Is it closed as of right now, or is it going to be closed, or?
Thank you so much for your question, Samantha. Scott, our Director of Emergency Management, will take that.
Thank you, Samantha. That's a great question, and I'm sure you're looking forward to getting to your campsite. I would encourage you to go to alberta.ca/COVID. There's a frequently asked questions box that's there. It could be answered there. If not, I encourage you to reach out to Alberta Parks in their website, and perhaps there's some answers there.
Thank you so much for that, Scott. And again, the province is actually recommending that there are no mass gatherings, which actually prohibits gatherings in groups of more than 15, both inside and outside. So that would likely pertain to campgrounds as well. So definitely head to the alberta.ca/COVID-19 website, and hopefully you can get some more information on that there. Our next question comes from Joe. Joe asks, will road, water, and sewer construction continue this summer despite the virus? Jamie, could you take this, please?
Thank you, Jill, and thank you, Joe, for the question. Short answer, yes, they certainly will. And there is multi-year projects that will certainly continue into this construction season. And there is new projects being tendered in the coming week.
Thank you so much for that, Jamie. Again, we only have about 5 minutes left here, so I believe we're going to take our last question. Our last question comes from Edith. Edith asks, what is the airport doing to make sure passengers who are sick do not get on a flight? RJ, could you address this, please?
Yeah, absolutely. So this past Monday, the federal government introduced a new order for all air operators in the country who are now required to deny boarding to any traveler who has symptoms of COVID-19. So this will apply to all domestic and international flights. This new, much stricter measure adds to the many precautions that, of course, airlines have already taken, as well as airports, as we try and prevent this spread. There is more information on our website, and I would encourage folks to go to flyrmwb.ca COVID-19 for further information on this new order that airlines are required to follow.
Thank you so much for that, RJ. And I believe that Mayor Scott got an answer on the renter question that we had earlier, so he'll address that now.
Yeah, I believe we lost the person who had called in and asked the question, but he was asking specifically about residential renters. And I'm just going to read from the one of the packages of material we received from the province. So this is a provincial release. It says a new package of direct supports and deferrals is being provided to provide security for residential renters amid the financial burden brought on by the COVID-19 crisis. Tenants will be protected from eviction for non-payment before May 1st, 2020. Rents will not increase during the state of the public health emergency, and late fees cannot be applied to rent payments for 3 months. So I'm sorry that we lost you on the call. I know that you were going to wait for us to get back to you, but that is the answer. And if you Google, the releases, you'll be able to come up with that. It's a provincial release.
Thank you so much for that, Mayor Scott. We actually got a couple of really interesting questions that we want to address before we close out tonight. So our next one actually comes live on the line. I don't have a name. I believe the initial is just D. So D, your line is open. Please go ahead.
Hi, thank you for taking my question. It's just about the most vulnerable in our community, the homeless. What kind of support are we providing for them and the organizations that help those people, like the Center of Hope and the Food Bank?
Thank you so much for your question. Scott will address that.
Thank you, Dee. Currently, the RMWB has the Vulnerable Persons Registry, and that has a defined description of who's eligible for that or not, and you can find that on our website or call the Pulse line, and they'll put you in contact for that. Additionally, we're currently working with our Community Services Department on looking at alternative ways for people that may not qualify for the Vulnerable Persons Registry, however, still have challenges, and they'll continue to work with that. So I encourage you to watch for that information as that team continues to develop that and communicate it out into the community.
Thank you so much for that, Scott. I believe Jamie will also weigh in.
Thank you, Scott. Just to add to what Scott was saying, the RMWB has collected funds from the federal government's commitment to COVID-19 response to homelessness. Our community services team will be working closely with the local agencies who serve individuals and families that are at risk or currently experiencing homelessness, and the Homelessness Initiative Strategic Committee, or HISC, to make recommendations to Council for the allocation of these funds. We expect to have the recommendations to Council before the end of April.
Thank you so much for that, and I believe Mayor Scott would like to say something.
Sure. I just want to let you know that I've been in touch with both the Food Bank and the Center of Hope and a lot of the other social profits in town. We're keeping a close eye on how they're doing, and I anticipate that they're going to have a great number of needs as we go forward, but it's something that our council is keeping a very close eye on.
Thank you so much. Our next question comes from Kay. Kay asks, the number of cases in the region has changed from 4 to 3 on the Alberta government map. Why is this? We have Murray or perhaps Dr. Klein take that, please.
Yes, maybe I can address that. I think that this issue's come up for several different areas as the data comes into Alberta Health, who actually produce those maps. They do some reconciliation to check the postal codes and to confirm the diagnosis, and in some cases, some instances, those cases that were attributed to one area are actually changed or found not to be cases or moved around. So in smaller communities with smaller case numbers, that can make quite a difference when people are looking at the numbers. But as the information is evolving, there will be those sort of slight variations as the data is refined and updated by Alberta Health.
Thank you so much, Dr. Klein. Our final question tonight comes from May. May asks, is there any projection about when this pandemic is going to end? Perhaps we could start with Dr. Klein from a health perspective, please.
Sure. I know there's a lot of interest from everybody about what's going to happen in the weeks and months ahead. I know that the Premier actually announced today anticipating a peak for hospitalizations in mid-May. I think it's reasonable to expect that this will at least go on for several weeks, but it will really depend on a number of factors, including how effective all the measures that are put in place today will be at controlling the spread of the virus. I think what we're seeing around the world is that places that have put in those aggressive measures, such as social distancing, the strict isolation recommendations, and the closures of things like mass gatherings in schools, that it really does make a difference to slow the spread of the virus and what the communities are experiencing. So I think it's all of our hopes that those measures will be effective, and that although it's likely to go on for several weeks still, that it will not be in vain, and that the impact on the lives of Albertans will be minimized. And so I know that it's hard for everybody to be following these instructions and to be at home and with things closed and impacting people's livelihoods. So from a public health perspective, I just want to say thank you to everybody for doing their part in trying to minimize that risk and get us back to being the thriving Alberta that we always have been as soon as possible.
Thank you so much for that, Dr. Klein. And before we wrap up this evening, Mayor Scott would actually like to say a few words. Go ahead, Mayor Scott.
Sure. I just want to thank everyone who participated tonight and all those who asked questions. There is going to be a technique for any question that didn't get asked for that question to be relayed to the municipality so that we can coordinate a response. And so please stay tuned for that. I also want to put out the message that we as a community have been through challenges before. And I acknowledge that we've never been through anything quite like this. But we came together before, and we're going to do it again. And I just want people to go forward with hope. We are definitely going to meet this challenge. You have a mayor and a council who's very committed to this region. We all love this region, and we're very passionate about it. We don't always agree on everything, but one thing we all do agree on as a mayor and a council and a municipal staff is that we care deeply about what happens to all the people of this region, and we want to come through this in a very strong way. So please take care of each other.
Thank you so much, Mayor Scott. And on that note, Mayor Scott did mention that there would be an avenue to get your questions answered. So if you have an important question that we were not able to get to this evening about municipal services or the municipal response, please email your question to townhall@rmwb.ca. That's townhall@rmwb.ca. I want to thank all of our panelists for joining us this evening, as well as the residents. Please stay safe and have a wonderful evening.